Okay, welcome everybody. Thanks so much for joining us to talk about the 2019 novel coronavirus. This is Dr. Caitlin Padati. I'm the state epidemiologist and public health medical director here at the Iowa Department of Public Health, and we'll be talking about COVID-19 today. Just a couple of housekeeping notes. We're going to have all participants muted throughout the presentation. We do want you to ask questions though, and you can submit those directly through the question feature on your control panel, and we'll be answering questions at the end of the presentation. And this session is being recorded, and it will be made available to you after we've finished, and that will happen through an email that you'll receive after the presentation. So what we'll talk about today, we're going to give you a little bit of background overall on COVID-19 and the current epidemiology or patterns that have been changing sort of quickly. We're going to talk to you about some of the traveler monitoring and healthcare screening public health activities. We'll share with you some specific guidance around COVID-19 for colleges and universities. We'll talk briefly about some communication resources, and then we'll open it up for some question and answer. So to start with, when we think about coronaviruses, we're talking about a large family of viruses, and they get their name because the structures on the outside of the virus look a little bit like a crown. We know that in this family, there are some viruses that can infect animals and some that can infect humans and some that infect both. And in fact, there are 7 of these coronaviruses that we know of that infect humans, and 4 of those 7 are actually very common. They're going to cause a very mild, self-limiting upper respiratory type illness that's going to look sort of like a common cold. And most of us have probably actually had one of these in our lifetimes. And these are the sort of common viruses that are currently available to be detected on some of the testing that's available in a routine doctor's office visit. Now, 3 of those 7 are actually more rare, and they're capable of causing more severe disease. These are going to include MERS, SARS, and the 2019 novel or new coronavirus, which is now being called COVID-19. So this COVID-19 virus was actually first recognized back in December of 2019 in Wuhan in the Hubei province of China. And a lot of the first patients that were recognized as part of this outbreak had an association with a large seafood and live animal market in Wuhan, which was suggesting that this was a virus that moved from animals to people. Now, since then, we've seen that this virus is able to move from person to person, and we've had over 35 different jurisdictions report cases. The virus seems to move between people who are in close contact with one another, and we define that as about 6 feet. And we think it's moving through respiratory droplets. So that means that when somebody who's infected with the virus would cough or sneeze, little droplets of liquid could land in the mouth, nose, or eyes of someone who's nearby, or even possibly be inhaled into the lungs and could then make that person sick. We think that people are most contagious when they have the most symptoms, and it's possible that this virus could be passed by touching a surface or object that has liquid with the virus on it and then touching your mouth, nose, or eyes. But we don't think that this is the main way that this virus spreads, and they don't seem to last particularly long on surfaces. I wanted to take a minute to share some of the publicly available resources for looking at some of the case counts that have been changing pretty quickly around the world. So many of you might be familiar with this dashboard that's available through the World Health Organization, and this is an example of a resource where they're reporting cases that are coming from the various health ministries or centers for disease control in different countries. And you can see that unfortunately this is actually a little bit out of date now, we're actually at over 90,000 cases and 3,000 deaths from across the globe. Interestingly, it does appear that the case counts in China are stabilizing, although unfortunately we're starting to see additional cases in other countries and places around the world. And I would say that this is an example of a tool, either this dashboard or there's a similar dashboard available through Johns Hopkins University that you may have seen, and that might be helpful for sort of understanding some of these overall patterns. But again, I would just recognize that sometimes there are some differences in how some of this information is reported, and sometimes there are some delays in how these numbers are reported as well, but they can be helpful to look at. I wanted to sort of recognize related to that things have been changing very quickly in relation to the COVID-19 response. So, even over the course of hours or days, we continue to get more information and hear more about what's going on. And we know that it can be hard, first of all, to keep up with this information and to know what it is, that you need to do with it. And so one of the things that we really want to emphasize for you today is that we want you to know that you can rely on local and state public health to be providing you with up-to-date and accurate information. We want you to know how to visit our webpage and how to find a lot of the resources that we're sharing. And we'll continue to share information as things change, which they may continue to do. So what you're looking at here is the data that's being shared out of the CDC for the situation here in the United States. So at the top, you're going to see a table that's sharing the COVID-19 cases that have been associated with travel or have been identified in the community. And this is being updated every Monday, Wednesday, Friday. So this is also a bit out of date at this point, but we're at around 43 cases. And unfortunately, this number 2 death has now increased to 6 deaths. You're also seeing a table that's describing the cases that are being tested, in conjunction with the CDC. And then you're seeing a table of individuals who become ill associated with the group that was repatriated to the US from the high-risk situations in Wuhan and on the Diamond Princess cruise ship. And this group is being treated a little bit differently from the travel-associated or community-identified cases because it represents a slightly different risk, and so they're being reported in a different way. And then lastly, you can see this map showing states that have reported cases. And again, CDC is providing updates on this information for the most part every Monday, Wednesday, Friday. Similarly, if you visit the Iowa Department of Public Health website, you'll find that we are also providing information for what's going on here in the state and sharing numbers that we're updating, again, every Monday, Wednesday, Friday. So at the top, you're going to see a table of individuals across the state that are being monitored by public health. So that will include individuals who are being monitored as well as those who have completed the public health monitoring. And then below that, you'll see a table that's describing individuals who have been undergoing testing here in Iowa. And again, we're going to be providing updates on this every Monday, Wednesday, Friday, but remaining flexible and certainly sharing information, as needed and as appropriate. So related to sort of understanding what some of these risks are and what are some of the things that we need to think about and plan for, right now an important part of this is understanding what some of the travel or geographic advice and potential risks are. And so to that end, what you're seeing here is the travel health notices that have come out of the CDC that are going to be important to be aware of. So at the top, you'll see that the CDC is recommending travelers avoid all non-essential travel to China and Iran, and that there are potentially restrictions on entry to the United States associated with these jurisdictions. The CDC also recommends that non-essential travel be avoided to South Korea and Italy. The CDC has a level 2 warning in place for Japan, so that's for older adults or those with chronic medical conditions to consider postponing travel. And then there's a level 1 travel advisory for Hong Kong. And again, I want to recognize that one of the things that we know that's been challenging about this response is that the information, particularly around, what to think about when traveling, has been changing. And we do want to work with you to continue to provide up-to-date information. And we also want to recognize it's possible that this information could continue to change. And so thinking about, making sure that we visit the CDC website and knowing how to visit the IDPH website and what to think about in planning for upcoming travel will be important. So I'd like to turn now to Dr. Garvey, the Deputy State Epidemiologist and Public Health Veterinarian, to talk to you about some of the monitoring and screening activities that public health has been doing.
Great, thanks, Dr. Bedati. So I just want to take a few minutes to talk through what our public health and healthcare partners are currently doing to both monitor returning travelers and to screen sick individuals when they present for care. So first we'll start with monitoring of travelers returning from mainland China. So in accordance with the President's Task Force on Coronavirus, we are screening travelers from mainland China because that area of the country continues to have high rates of illness. There's currently no plan to expand traveler screening to include travelers from additional affected areas. And when I say affected areas, for the remainder of the presentation, just know that I'm talking about the areas of the world that have either a level 3 or a level 2 travel advisory. Those are the advisories that Dr. Bodotti showed you on an earlier slide, and that they're posted on the CDC website. So again, there's no plan to expand traveler screening to the other areas that are affected. However, we are asking returning travelers to voluntarily isolate themselves, and we'll talk about that here in the coming slides. So back to travelers from China. So the way that travelers from China are being identified is that flights from China are being funneled into 11 airports across the US, and it's the airports listed on this slide. Anyone who has symptoms of illness at the time in which they arrive in the US, they are referred for health care immediately, so in the location of the airport itself. And they're assessed for symptoms of COVID-19. If testing would be indicated, that would be facilitated there on site. If people are asymptomatic, so if they're well and they're not having any symptoms, they are allowed to continue to their destination. And then CDC is notifying state health departments through a secure communication system that we use for many different things called EpiX. So they're notifying us of the returning travelers who are coming to Iowa, giving us their contact information. We're making contact with those individuals. We're assessing their level of risk based on where they were in the country, what types of contact they had, whether they were in any health facilities, for example. And then we're taking additional steps. So depending on their level of risk, and I won't get into the individual levels and what the criteria are for meeting each of the risk levels. That's available on the CDC website if you're interested. But anyone who would be assessed to be at high risk, they're required to stay home. They're issued a public health order that requires them to stay home for 14 days after they leave mainland China. They're not allowed to go about their daily business. They need to stay in their home, and they're required to check in with local public health partners twice daily for the 14 days. Again, 14 days after they leave mainland China. Anyone who's at medium risk has pretty similar restrictions. The only difference is these individuals are allowed to do non-congregate activities outdoors. So they can go for a jog, they can go for a walk, they can ride their bike. Other than that, they're required to stay home and stay away from others. They're also required to check in with public health twice daily. And for the low risk, these individuals are required to check in with public health twice daily. And when I say check in, again, we're meaning that they need to take their temperature, make sure they don't have a fever, and confirm that they don't have any symptoms. But these individuals are allowed to go about their daily business. If they're traveling out of state, long distances, then we ask that they coordinate that with public health, but otherwise they can return to work, school, all of their activities. So that's currently what we're doing to assess travelers returning from mainland China. So as I mentioned on a previous slide, we are asking people who return from the other affected areas outside of mainland China to isolate themselves for 14 days and monitor themselves for symptoms. So if they get a fever or respiratory symptoms, we ask that they call their healthcare provider and notify them of their travel prior to going into the office so that their healthcare provider can give them advice on whether they need to be seen in the office, and if they do need to be seen, can give them instructions to make sure that they're not exposing other patients and staff when they're in the facility. So I'm going to shift gears now and talk about what we're asking healthcare providers to do for screening when patients are calling to make appointments and when they're presenting for care. So we're asking that all healthcare providers screen patients, again, either at or before point of registration. The screening questions we're recommending are, do you have a fever or respiratory symptoms? Did you travel from an affected geographic area within the 14 days of getting sick? And again, affected geographic area are those areas of the world where there are level 3 or level 2 travel advisories. So right now that includes China, Iran, Italy, Japan, and South Korea. However, as Dr. Badati mentioned, this is a rapidly changing response. That list could be amended or updated at a moment's notice. So it's important that we're kind of paying attention to the CDC website so that we're knowing what parts of the world are seeing the highest levels of activity. Now, the final screening question is, did you have close contact with a person who's laboratory confirmed to be infected with COVID-19 in the 14 days before you got sick? So again, we're asking all healthcare providers to ask those 3 questions when patients present or they call in to make an appointment. If patients screen positive, so if they say yes to 2 of those 3 questions, then we're asking healthcare providers to don appropriate PPE. So that would include using standard, it would basically be wearing a gown, gloves, a fit-tested N95 respirator, and goggles or a face mask. So that's the recommended PPE. We ask the providers to don that PPE, go in and talk to the patient to assess their vital signs, to collect additional information about their symptoms, to collect information about their travel and the types of exposures that they had when they were in one of those affected areas. Now, then we advise the healthcare providers to call our office and we'll consult on whether testing would be appropriate. Now, the national testing criteria are listed on this slide. So a patient needs to fit into one of these criteria in order for them to be tested. Right now, the only place in Iowa that is performing testing is our state public health laboratory. They are performing testing in accordance with the testing criteria, and they have about a 24-hour turnaround time. So we're fortunate to have them as a resource in our state. So I'll just briefly move through this criteria. Anybody with fever or signs of respiratory illness and who had close contact with a laboratory confirmed patient, so confirmed to have COVID-19 in the 14 days before they got sick, those individuals would be tested. Anyone who had fever and symptoms of lower respiratory illness that required hospitalization and had a history of travel to an infected area within the 14 days of symptom onset would be tested. And the final criteria is fever with severe acute lower respiratory illness like pneumonia and ARDS requiring hospitalization without an alternate diagnosis. So if they have been tested for other infectious agents and those are all negative and someone's severely ill, even in the absence of an exposure history, we would test those individuals for COVID-19. So before we transition into our specific recommendations for institutions of higher learning, I really want to take a minute and talk through what social distancing really means. I think that there's some misconceptions where people think when we say social distancing, we mean everybody needs to stay inside their home, and that's not what we're recommending. So if COVID-19 were to circulate in specific communities in Iowa, public health very likely would make the recommendation for social distancing. And when we say that, that could include canceling K-12 schools, recommending that you all cancel your college classes. We would also recommend canceling events and large meetings. We would recommend not going on non-essential travel, so canceling non-essential travel. We'd encourage people to work from home if that's a possibility. Avoid gathering in any place, like lunchrooms, for example, or other areas, and really maintaining a distance of at least 6 feet away from other people. Dr. Badati touched on this already, but really the thought is that this virus is being transmitted through droplets. So 6 feet is a guidance that we really abide by when we're concerned about potential droplet spread. Excuse me. So for businesses that provide services like restaurants, for example, we would recommend that you consider expanding your carry-out services. Or if you are going to continue to provide meals in your facility, make sure that you're spreading out the tables. And for customer service-oriented businesses, we're recommending frequent use of hand sanitizer. We're not recommending that the general public starts wearing masks. We're just recommending that they maintain that 6-foot distance if possible. So we've had a lot of questions about, can you tell us, like, when exactly will you recommend social distancing? And this is going to be really a case-by-case decision based on what we know about the virus and how it's circulating in specific communities. So this would be a community level decision that we would make in partnership with our local public health partners based on the activity level of COVID-19 in those communities. All right, we're going to transition and talk about planning guidance for colleges and universities. This guidance was posted on our website earlier this morning, so it should be up there. If it's not up, it will be there shortly. And so we'd encourage you all to take a look at that document. I'm going to really just walk through that document in detail here and discuss all of the different components included in it. So we would recommend that you all review and update and implement your emergency plans. We recommend you do that in cooperation with local partners. And it's always important that those plans build upon everyday policies and practices, so we're not doing something drastically different than we normally do. We just want you to really focus on the strategies you're using to cut down on the spread of infectious diseases. So the things that you're doing for influenza are also going to be effective with COVID-19. So it's really those common sense preventative actions. So for example, really driving home that students, staff, faculty need to stay home when they're sick, pushing the covering coughs and sneezes, and cleaning frequently touched surfaces. Hand washing is incredibly important with all infectious diseases, but it's important with COVID as well. So soap and water is always the best bet. If that's not feasible, then hand sanitizers with at least 60% alcohol are sufficient as well. And we'd encourage you to share your emergency plan with local partners like local public health, local emergency management, and make sure that your plans address how you're going to be regularly communicating information back and forth with these local partners. We'd encourage you to really monitor and plan for absenteeism. So you should really know your usual absenteeism patterns for this time of year in your institution and on your campuses. Consider implementing or identifying processes for your faculty and leadership to report noticeable changes in absenteeism to a designated person within your administration. If you are seeing increases of illness, you should be alerting public health officials, either our department or your local public health department, about any significant increases in student, faculty, staff absenteeism, or an increase in traffic to your student health center. Now, I know this is tough right now because we're also seeing extremely high levels of influenza activity, but if you're seeing an increase above kind of the levels that you were at or over what you would expect, we would really appreciate a call so we can work with you to figure out if additional steps need to be taken. You should really be driving home with your students, faculty, and staff that they should not be attending classes or work when they're sick, and be flexible to allow them to stay home and care for sick household members. Dr. Badati mentioned that there's a whole spectrum of illness with this virus. Some people are severely ill, others are more mildly ill, and they can be cared for in the home. Their CDC has home care guidance that can be used if there is a family member in the home that's more mildly ill. And so this is really a tool that we're going to be using to make sure that we aren't overrunning our medical facilities when COVID-19 starts circulating. So home care is something that is part of our plans, and we would encourage you all to be really flexible with your leave policies to allow individuals to care for sick household members. We'd also encourage you to make accommodations for individuals who might be temporarily unable to attend class, potentially because they have restrictions on them because of their travel. So as we discussed earlier, if you were in mainland China, we're issuing public health orders that mandate that you stay home for 14 days. For all other travel to an affected area, it's a voluntary process, and so we'd encourage you to make accommodations so that these students, staff, faculty can abide by those recommendations. We'd also encourage you to identify critical job functions and positions and plan for alternate coverage through cross-training of staff and faculty. And it's good to determine what level of absenteeism would disrupt your continuity of teaching and learning and research. We do have guidance for businesses also on our website. Later in the presentation, I'll show you how to get to those resources. But a lot of those continuity of business concepts that's in the business guidance would also be applicable for your institutions as well. So we'd encourage you to establish procedures for students, staff, or faculty who are sick with any illness on campus, procedures to make sure that if they become sick, they're sent to their place of residence as soon as possible, keeping sick people away from well people until they can get to that place of residence, sick residents on on-campus housing without COVID-19, and they aren't at high risk for exposure, they haven't been confirmed to have COVID-19, should still be isolated and away from others while they're sick. And student health facilities should review all of the infection control and screening recommendations. I just touched on those concepts a little bit. There's more in-depth information available on our website and on CDC's website. After this webinar, you're going to receive a link to the archive version of this webinar. You're also going to receive this PowerPoint set. So you'll have these links if you need assistance finding the IDPH and CDC websites as well. If there is a student, staff, faculty, someone in your institution community who's identified to be infected with COVID-19, public health is going to be working with you to take steps to cut down on risk or identify those at risk. So that's nothing that we're expecting you to deal with on your own. That's a function of public health, and we'll be working with you to make sure that we take appropriate steps. We'd encourage you to do routine environmental cleaning. So this time of year, we're just wanting you to continue to do what you're already doing for flu. So routinely cleaning those frequently touched surfaces like the doorknobs and light switches with cleaners that you typically use. They should be cleaning products that are intended for the surfaces you're using them on, and you need to follow the label instructions. Just a tip, if you have computer labs or commonly visited areas, you might want to provide some disposable wipes so that keyboards or shared desks or remote controls can be wiped down by the students, faculty, staff between each use. And I know that you all have pretty thorough communication plans, but it'd be good to review those because you're going to be critical in making sure that we can get out timely and accurate information to your community. So your communication plan should include strategies for sharing information without increasing fear or stigma. Keeping the community informed is really important in cutting down on the rumors. We've had a lot of misinformation and cutting down on the anxiety. If students and staff and faculty know that you're putting out sound information, that's going to help them feel better informed and aware of the current situation. So include strategies to communicate on what steps you're doing as an institution and what steps they can be taking as individuals. Also include strategies to communicate changes to the usual campus schedules or functions. That's important as well. Now, I think this guidance is national guidance. This is CDC guidance, and so you've probably seen this, but CDC is recommending that higher institutions of higher learning consider postponing or canceling student foreign exchange programs. So those students that are overseas, we would recommend taking them coming home, considering postponing any trips that you have taking students out of country and abroad. Those are all recommendations from the CDC, and I'm sure we'll get into some of the details of that in the question and answer session. But this is the guidance as it stands from CDC. All right, I'm going to transition and start talking about guidance for colleges and universities when cases are identified cases of COVID-19 are identified in the community. So we really want to emphasize that you don't need to make decisions about dismissals or canceling events on your own. Please reach out to your local public health officials, and we definitely can give you recommendations based upon the level of activity of COVID-19 within your community. We may recommend cancellations or class dismissals for 14 days or possibly longer, depending upon the level of activity of the virus within the community. So during these class dismissals, you can stay open for staff and faculty as long as those staff and faculty are well. And the students would just temporarily stop attending classes in person. Staying open would allow your faculty to work on lessons and materials that they could be sharing with students electronically, so you can continue teaching and learning. And it would also allow staff to provide other services that would help with the response efforts and support your on-campus students, so food service, for example. Again, if we were to make a recommendation to temporarily suspend classes, that recommendation would really be based upon what the current spread of the virus is ongoing in the community. And so the scope and the duration would really be made on a case-by-case basis using what we know about the virus and about the circulation within the community as a basis for those decisions. We would want to work, we being public health would want to work with you to make sure that our messaging is consistent about the nature of the exposure and also maintain confidentiality. So for example, if there was a student who was infected with COVID-19, we would want to work with you to message that in a way that did not identify that student and maintain confidentiality in accordance with federal and state laws. So if a student or a faculty member or staff notifies school officials that they've been diagnosed with COVID-19, please reach out to public health and we'll help you walk through what steps need to be taken. So in time, there may be additional reference laboratories that are able to do COVID-19 testing. All diagnosis of COVID-19 are reportable to the department, so we should know about those cases. But if you have a student that tells you they've been diagnosed before public health has reached out to you, please turn around and reach out to us and we'll work with you to figure out appropriate actions. And also, students, staff, and faculty who are well but are taking care of someone who's infected with COVID-19, if there's questions about whether measures need to be taken, please reach out to your local health department and we'll work through those recommendations with you. So if classes are dismissed, we'd recommend you consider doing the following: that you also cancel extracurricular activities. Again, the point of the social distancing is to make sure that we're not congregating in large groups, so we'd want you to to cancel meetings, performances, social events, athletic practices, and games. We encourage you to discourage students, staff, and faculty from gathering and socializing. So that would include at friends' houses or big groups gathering at restaurants or coffee shops. And we would encourage you to consider continuity of education and research. So thinking about planning for e-learning or digital or distance learning options as are feasible and appropriate for your facility. That would also extend to any research. So establishing continuity plans to address how you would temporarily postpone or limit or adapt research activities is important. You could consider using a lot of the infrastructure that you probably are already using, like Blackboard, or you could use Skype or Zoom to support this e-learning, and making sure that we're continuing the education. It's just that students would no longer be in person. It would all be via distance or electronic formats. Other student support services like online libraries, print materials being available or online, support student services are all important to think through and plan for. In addition, you'll need to determine how to convert these face-to-face lessons to online lessons. Might need to train faculty to do this if they're not used to doing online teaching, triaging those technical issues, especially if you have limited IT support and staff, and you might have to work through how to deal with students potentially lacking access to computers or the internet at home or in temporary housing. So all just considerations as you work through the planning processes. It's important to make sure that you're ensuring continuity of safe housing, so working in close coordination with your public health officials to make decisions about on-campus housing. If cases of COVID-19 have not been identified among residents of the on-campus community housing, students might be allowed to remain in on-campus housing. And in this situation, it'd be important to make sure that you're educating those residents on the precautions they need to take to protect themselves. So again, it's those common sense recommendations about isolating when sick, covering coughs and sneezes, washing hands frequently. Those would be very important messages to share with these on-campus communities if they were allowed to remain in the campus housing because there's no identified cases. If cases have been identified among residents of on-campus housing, we'll work with you to respond accordingly. They might need to be sick individuals, might need to be moved into temporary housing, or you may have pre-dedicated locations on your campus where sick students can be isolated with their own bathrooms, for example. So those are all issues that we'll work through with you as you, if you do have members of your community who are infected with COVID-19 in the interim, it's important to kind of be thinking through those issues. And remember to consider all types of housing as part of the response. So your residence halls, also your fraternities and sorority houses, or if you have other housing that you own or run, like apartment houses that are owned by your facility. So all of this needs to be taken into account as you think through how you're going to continue to provide housing for students. And as you know, many of the students are dependent upon your meal services to provide their daily meals. And so it's important to work with local officials to modify the food service if we were in a social distancing situation. So think about ways that you could distribute foods to students, especially those who are remaining on campus, if there were classes dismissed or activities canceled. So that might include like a bagged lunch or a grab and go option, or even meal delivery potentially. Just ways that you could continue to support this population in a time in which we were recommending social distancing. And we'd also recommend that you consider ways to continue support services on campus. So want to make sure that you have ways to provide students with medical and social services. We want to do this in a way that doesn't promote stigma. And we also want to be sure that we have structures in place to provide mental health support to students who may be experiencing a high level of fear or anxiety about the situation. And so you'll see some bullets included on this slide to just highlight some of the important components to really think through. So at this point, I'm going to turn it over to Polly Carver-Kim, our department's communications director, and she's going to talk to you about communication resources.
Thank you, Dr. Garvey. I want to thank the many of you who have already been in touch with me personally regarding guidance and information that you can put out to your folks. And I know a lot of you, I think all of you, have a really robust presence with the media. You're used to working with the media. Just a couple of notes, especially when dealing with the media when it comes to something like COVID-19. As much as possible, return phone calls and inquiries as soon as possible. And of course, if you want to consult with us or me before you do so, you are more than welcome to. My contact information will be coming up here in a slide or two. And of course, if you have questions that require consultation from Drs. Garvey or Pedati, I will talk to them before I provide you with an answer. Be transparent, but of course we always want you to put confidentiality first. And if you're considering putting out a notification to staff or students that has something to do with COVID-19, we would really appreciate it if you would let us know beforehand, and then we can work with you to make sure the messaging is on point with what we're doing here on the department level. For your information, we are updating numbers of people being monitored, tested, and test results every Monday, Wednesday, and Friday on our website. We are not doing anything in between those times just to maintain some stability there. We're not identifying the locations, as in city, state, or county, of those who are being monitored or tested, because there's no public health benefit in doing so. But as you know, the situation is changing quickly, and if it would become necessary for us to identify an individual based on a region or county or however that would be determined, we would do that if it was necessary to protect the public's health. If it was involving, let's say we were going to announce a county, we would notify local public health officials and make sure you were all aware of that before we did so. We don't want any surprises. For social media, I'd strongly encourage you to follow the department on Twitter and Facebook, and feel free to share and retweet our messages. We continue to develop infographics that you are welcome to use. Those are on the webpage that Dr. Garvey will point out here in a couple of minutes. There are lots of trolls out there with lots of information that isn't necessarily factual. We tend to try to just ignore them and let the debate play out among those who know what the situation is, instead of the department trying to have an argument online. When possible, though, we do offer the correct information online. Also, just a quick note, Dr. Pedati is going to be doing a Facebook live stream coming up here at noon that will be a media availability, but we'll be streaming it on Facebook as well. And we'll do those kind of things fairly often. So if you follow us on Facebook, you'll be able to know when those events are happening. Next slide, please. These are an example of some of the infographics that we have available for you, and there's more coming. And there's my contact information. So if you haven't reached out previously, please do so. Email is probably the best right now because I'm on a lot of these webinars and in lots of other meetings and talking with reporters, but I am always checking email. So I'm happy to help in any way I can. And back to Dr. Garvey.
Great, thanks, Polly. So I'm going to take a second here as we wait for your questions to get entered into the Q&A box. Please enter those now, and just show you how to get to our website. and where those resources are posted. We've had some questions about how to get there, so we're just going to walk you through it. Do you see my screen? Okay. All right, so if you just go to our, oops, excuse me, I hit a bookmark there. If you just go to our main, I didn't share. Okay, if you just put in our web address, which is www.idph.iowa.gov, you'll see a banner right here on our front page. Click on that, and that takes you to where all of our numbers are being updated. And if you scroll down, it has all of our guidance there. So you'll see that our guidance for businesses is posted there, for healthcare, for long-term care, for the general public. And this is where our university guidance is going to be posted as well. Oh, actually it is. It's under schools. Excuse me. So COVID-19 guidance for colleges and universities. And that is the document that I really walk through in the slides. So we recommend you take a look at that. And it has the planning guidance and also guidance for what to expect if there is transmission within your community. So with that, we will go ahead and start the question and answer portion of the discussion today. So the question about define community. Could IDPH ask that classes be canceled in Iowa City or Cedar Falls, but not Ames? Absolutely. So we're going to be looking at how this virus is circulating in specific communities to make those decisions on whether to recommend social distancing. Again, we know that when we make that recommendation, that has significant impacts on the community, and we want to make sure that that's definitely justified, and we will be making these decisions on a community level. We had a request to say more about self-isolation of returning travelers and how that's enforced. So for travelers returning from mainland China, those individuals, again, because we're being notified of them and we receive their contact information through the CDC process, they're being issued public health orders that mandates that they stay home for the 14 days. All other individuals who are returning from other affected areas were not receiving that type of travel notification. And so that is a voluntary recommendation that we're asking people to do if they're returning from those other affected areas. So we had a question of what does it mean to recommend that the student exchange programs be stopped. So I'm going to flip back to the recommendations from CDC, and I'd like to walk through those in a little more detail. Okay, you should be seeing that slide now. And CDC is recommending that colleges and universities consider postponing or canceling those foreign exchange programs. So it's not a requirement, it's a recommendation from the federal government and from us that you consider postponing or canceling those. So that means if you have groups of students that you're taking abroad, even if it is to an area outside of those that are currently being affected by the coronavirus, we would recommend that you consider postponing it because this is a rapidly changing situation. We aren't sure how it's going to spread across the world, and we want to make sure that we're doing everything we can to give you recommendations to keep your students safe. If you decide to continue those programs, that's clearly your option to do, but do know that when students return, they may be subject to restrictions or recommendations like those that we just discussed to self-isolate for 14 days. So the guidance from CDC is listed on the slide for additional reference, but that's the recommendation. Oh, in addition, I should say, if you have students who are currently abroad through one of these programs, we'd recommend that you make plans to bring those students home.
Yeah, and again, I think, I know this is a lot. I think the way to think about this reasonably, what we're trying to recognize is this virus has demonstrated spread to different countries pretty quickly. And because we can't necessarily predict what will be the next country or location that would have a challenge, we want to make sure that we give you the time to think through whether it would be prudent to sort of adjust some of these programs and plans. So again, just trying to be reasonable about the fact that things have been changing quickly and to think through what makes the most sense for your students in your program. There's a question that is asking about, is this considered airborne or droplet? So we think that it's transmitted through droplets. We are asking that healthcare workers use airborne precautions when evaluating and treating patients. That's in accordance with the current CDC guidance, which is in some parts different from World Health Organization guidance. We're going to continue to follow and recommend, the CDC guidance. But I would also say that that's an example of something that may evolve over time as we learn more. But our goal here is just to make sure we're keeping, our healthcare workers appropriately protected. There's a question about CDC recommended disinfectants for surfaces. So there's no specific brand, or type. I think what's important to know is you want to make sure that you're using a cleaner appropriately. So that means reading that label, making sure that it's, an EPA approved cleaner for the surface and the type of cleaning that you're doing, and making sure that you're adhering to things like recommended contact times. So just taking a look at that label and making sure, you're following the directions as indicated. There's a question about, with no reporting from Africa and Russia, do we expect that they're just not testing? It's a good question. I don't know the answer, but that's in part why you're getting some of the general recommendations from CDC and from us about considering to postpone study abroad programs in general, because again, there are some things we just don't know about, the situation as it evolves in other countries or jurisdictions. There's a question about, considering that many people have mild symptoms, aren't the testing criteria somewhat stringent? Yeah, you're right. So we are focusing our testing at this point, following the CDC and federal guidance on people with more severe symptoms, so those who are severely ill. And you're right, it's possible that that would mean that we may not be catching all mild illness. There are other mechanisms and approaches that we're taking in conjunction with other states and with the federal government to try and get a better overall picture of what might be circulating. But I think it's important to keep in mind that as we think through how we respond to a new illness, we have to be flexible. And so right now we're trying to identify who we think cases that we think might be most acutely ill. And it might eventually reach a point where there would be people with more mild illness. But if there were people with mild illness, some of those people might be appropriate for just recovering and being managed in their homes like we would with a mild respiratory illness. And so again, we kind of want to think through what are going to be the clinical needs and what's most appropriate from a public health safety standpoint for the variety of illnesses that we could potentially see. There's a question about the confirmation test method the CDC is using. The CDC is using a reverse transcriptase PCR, and that's the test method that our state hygienic laboratory is using as well. There's a question, if our university has students scheduled to arrive from level 2 or level 3 countries, based on CDC, we're telling them, contemplating telling them not to come. And this person is wondering, it would be nice to know what others are planning. So I think the recommendation would be that if you have somebody who's in one of those level 2 or 3 countries, again, it's possible that this is an example of something that could change over time as we learn more from our federal partners. But since we don't necessarily know at the state level who all those people are, we've made a broad recommendation that people who have been in those locations should consider, self-isolating and monitoring their symptoms, to be on the safe side. There's a question as it relates to foreign visitors. Discuss the guidance for a 14-day isolation. Again, that's going to involve, monitoring for your symptoms, and if you do become sick with fever or cough or respiratory symptoms, calling ahead to your healthcare provider to determine if you need to be seen and what's the best way to do that, to let them know about your travel. And we'll share some additional information that I think will be helpful for you on our webpage here shortly. There's a question about what do you recommend for us as spring break is happening? Should we track where students are going and returning? Again, I think each institution, is going to have to think through what's achievable and what makes the most sense for them. I think our goal right now is to make sure that we're taking advantage of this time to share with you a variety of things that you might think through and ways that you can share these messages with your faculty and staff and your student bodies to help them understand, what are the options that they have and the things they can do to protect themselves. There's a question about a specific group of people who are scheduled to go to London, Paris, and Amsterdam. Would you recommend postponing this? So I think you're describing an example of a group spring break trip, coordinated through a school that CDC is asking that institutions of higher learning consider postponing. And again, the reason that CDC is providing this advice and the reason that we're also sharing it is because, things have been changing quickly. And so it's going to be a little bit hard for us to tell you what the situation, in any of those places would look like in a couple days. And we just want to make sure that you have the opportunity to think through what makes the most sense for you and for the students and faculty that you have. There's a question, why should all study abroad be canceled, study abroad travel be canceled, but not all travel, including business and pleasure? That's a great question. So again, when we think about illnesses like this and the way that they move from person to person, right? And they move easily in groups of people. And so you're right, it's certainly prudent for anybody planning any kind of travel to review the CDC's website, to look at what the travel advisories are. We would offer you that advice whether you were traveling anywhere in the world at any time of the year. That's always a good thing to do so that you know what's going on and you have that situational awareness. But again, the more focused advice that I think you're hearing coming from CDC and from us is related to the idea that we've got sort of a school coordinated event with a group of people who would then be reintroduced to a group of people living together. And again, when we think about how these kinds of viruses move, they move through groups. And so that's where some of that reasoning is coming from.
We had a request to define affected area in greater detail. And so I went to the slide on the international travel notices. And when we're saying affected area, we're talking about those areas that have a level 2 or a level 3 travel notice in place. And so currently that would include China, Iran, South Korea, Italy, and Japan. But as we've mentioned, this is changing on a very regular basis, and so we'd recommend that you check this site frequently. This is on the CDC website. If you click on travel, you'll go right to this document that we're looking at right now on the slide, and that will inform which countries are included under the affected area grouping. Any concerns over food preparation and transmission? The most important thing is to make sure that your food service workers remain well. And we would always recommend frequent hand washing in the kitchen to help with all issues, but that's especially important with COVID-19. So again, making sure that your kitchen workers are still well, promoting frequent hand washing are all important things to consider. And then again, more on the service side of the food preparation is thinking about grab and go lunches or making sure that we're spacing out tables if we do get into a situation where we're recommending social distancing so that students can really maintain that 6-foot distance from each other. If someone tests positive on a Saturday, Sunday, Tuesday, or Thursday, would we not share that information until Monday, Wednesday, or Friday rolled around? So if we had a positive case, we would likely be sharing that information in a much more timely manner. We wouldn't wait for that, but we are just wanting to standardize how we're reporting all of our numbers so the media and the public know when to expect those updates. So as long as we're having negative results, we're sticking with that schedule. What are the recommendations for whether or not to remove students from healthcare clinical sites when COVID-19 is diagnosed?
Yeah, so I imagine you might mean like if you have, nursing or paraprofessional or medical students. Again, I think that would be a decision that we would come to, together with a facility, and an institution that would be caring for those kinds of patients. And, likely the recommendation at that point is going to be, to minimize contact, for as many people as possible. So we'd be working with you on that.
We had a request, people are having trouble finding the CDC recommendations for the international travel issue. We've had a request for me to show you specifically how to get there. So bear with me as I switch my screen again and I'll show you how to get to that site. All right, so it's just cdc.gov. And when you get to the CDC site, just click on coronavirus and special summer. Give me 1 second to click through the right way here. There we go, communities, schools, and businesses. Click on that link. And then you'll see colleges and universities. And it's the second box that's listed there, guidance for student foreign travel for higher institutions of education. And this guidance is basically exactly what we have included verbatim in our guidance and in the slides. So that's how you get to that recommendation. If Italy is at a travel advisory level 3, are you screening those travelers like we are travelers from China? The answer to that is no. And the basis for that is the President's Task Force on Coronavirus maintains that we need to continue to screen travelers returning from China because they're seeing higher rates of illness in China as compared to some of the other countries. So that's the basis for the differentiation. We aren't receiving notification of returning travelers from those other locations, just mainland China.
Are you suggesting that all spring break trips be postponed that are outside of the country, even if they're in areas with no coronavirus right now? Yeah, so that is the advice that we're asking you to consider, and that's the advice that we're getting through CDC. And again, the reason there is because things have been changing quickly. And so we just want to make sure that we give people the opportunity to think through, okay, if we have a trip planned with a group of our students, even if we know it's not in one of these locations where there have been reported cases, do we want to think through what makes the most sense for everybody? And so again, just taking advantage of the opportunity to think about, what makes the most sense and consider postponing things, if you can, I think is a reasonable step to take, just because we've recognized that things have been evolving quickly with this particular situation.
Just had a request to show you how to get to the infographics that Polly mentioned. If you go to our main page, click on coronavirus or COVID-19, that'll take you to our novel coronavirus page, scroll down to the bottom, and that's where all of our communication resources are, like our infographics.
There's a question about other household residents. When someone is self-isolated, are they also required to stay in? No, the self-isolation would just apply to the person who had been traveling. And again, this is a piece of advice that we're giving for people to consider who have come from an area with community transmission. This is not something that we're receiving federal information on at this time. So this is just a recommendation that we're providing for people in the general public to consider, staying home and keeping an eye on their symptoms. And I will say that this is, again, an example of something that could change and might be adjusted in the future as we learn more.
We have a question from someone about an internship in South Korea in late May, wondering whether we think these guidelines will still be in place at that time. And as Dr. Paredes mentioned, this is rapidly evolving, and so we can't really predict what the recommendations are going to be down the road, but certainly the recommendation right now would be to consider postponing that.
There's a question about students transiting through a level 3 or level 2 country. Right now, the advice is that if you're not leaving the airport, there's not a need to be concerned at this point. If you're spending enough time in a layover that you're leaving the airport and going out into the community, then we would ask you to consider that self-isolation. Again, the idea is if there's a place that you're in that has had community level spread, we just want to acknowledge that as a potential risk.
A request for information for churches. This person says they'd be inclined to follow the lead of their local schools on social distancing. So a couple of things there. We are in the process of creating some guidance materials for churches. That's still in the pipeline, so it may be a day or two before you see that posted. When it does get finished and cleared, it will be posted on the IDPH website that I've shown you. As far as, I think the question is really asking, how do we know when public health is going to recommend social distancing? And when that recommendation is made, that's going to be something that we share widely. Your local officials will be sharing it widely. We'll be sharing it through the media, and so it will be very clear when social distancing measures should be taken. From a church perspective, it's important for churches to be thinking about what social distancing means for them as well.
There's a question about whether schools need to have supplies of N95s. No, the general public, does not need to have a supply or wear masks of any kind. That recommendation is for healthcare providers. There's a question about there's a couple questions here about domestic travel. I think you're all hitting on, exactly an important point, that as we've seen things change, is it possible that there could be recommendations around domestic travel? Certainly we're keeping a close eye and speaking really, I would say, daily with our other state partners. And if there were situations that we felt warranted a recommendation, we would be sharing that. So there's no particular recommendation around domestic travel at this point. And again, a lot of the advice that we're providing, it's certainly COVID-19 specific, and we know that there are things that are new and different about this virus, but we also want people to keep themselves healthy when they travel during flu season, and keeping in mind that there are respiratory viruses like flu that are circulating at this time of year that you also want to protect yourself from. So having all of that situational awareness with regard to travel, even within the US, that's a good thing.
We had a couple of questions really related to how will the decisions about social distancing be made, and that's really going to be dependent upon the activity within the community, what we learn about the virus. All of those factors are going to be really a component for making that decision. There's a specific question about, is there any reason that classes would be canceled for higher education, but not for K-12? And likely if we're making those recommendations, they would probably be community-wide, but certainly it's a case-by-case decision. So theoretically, that might be a possibility if we're particularly concerned about a campus, but again, it would be a decision made at the time based upon the information that we have.
And again, I know the things that we're describing, and when we talk about social distancing, this is a lot. We want to just make sure we're sharing with you what the full range of public health tools are that we consider when we talk about having, illnesses in a community. And these are tools we consider whether we're talking about pertussis, chickenpox, measles, flu. These are strategies and tools that we employ as ways to limit the personal interactions we have, because if we're not interacting closely, then viruses can't move from one of us to the other.
Question about whether a patient would need to pay out of pocket for COVID-19 testing. Right now, the testing that's being conducted at the State Public Health Lab is obviously comes with a cost, but that's a public health cost. That's not a cost that's then passed on to the patient. Now, once other laboratories, reference laboratories, develop testing capability, if testing is performed at a different institution, a non-public health institution, there may be or there will be charges for that service.
Let's see. There's a question about, is testing for coronavirus and the flu similar? They're different tests, they're different illnesses. The immunity and treatment wouldn't necessarily be the same for those things, but they typically both involve a swab, a nasal swab, something like that.
Question about this facility operates community-based correctional offices and offender residential facilities. We are planning, and they're asking, is there anything more specific for that audience? We're planning another webinar for Thursday that should be sent out shortly, which will address law enforcement considerations and considerations for jails, prisons, and residential facilities like yours. So be on the lookout for those. That webinar registration information will make sure it gets to you.
There's a question about self-isolation in a campus setting. So you're thinking about things like air systems and bathroom requirements. So I think it depends on whether we're talking about people who are just sort of keeping to themselves to monitor symptoms, or whether we're talking about somebody, who would be ill. If we're talking about somebody who's ill, we would sort of provide you with more advice on that, but the general idea here is you're trying to keep people away from others. And again, the idea is anytime we can limit interactions between people, then we reduce the virus's ability to move from one person to the other. We know that there are practical challenges, particularly in, college and university settings, with how to do that sort of thing. And so again, we're happy to try and think through with you, what makes sense and what's available to you.
There's a question about, does IDPH or CDC provide any kind of support to offset the cost of changing airline tickets for the recommendation to not travel, take groups international? And I'm sorry, we don't have any way to help reimburse those costs or to get any kind of change fee waived by the airlines. That would just be potentially share the CDC documentation with the airlines, and we apologize, but we don't have any way to get that waived for you.
There's a question about speaking about potential PPE or personal protective equipment shortages. This is a question that always comes up whenever we talk about, widespread infectious disease, again, whether that's flu or something new like COVID-19. We're working very closely with our federal partners, with, other partners in our region to provide information and to receive information about how they're monitoring supply and production. And we're also asking our partners throughout the state to help us keep an eye on supply and production so that we can monitor that. So, we're aware of the concerns and we're keeping an eye on that information.
A couple of questions related to, if we have a student that tests positive, is it better to move that student out of their current housing or move all the other students around them? I think that's a bit situation dependent. So if we have a positive student, we're going to be talking to you about what the options might be and can help you walk through potential solutions. There's a question about, if a student is taken to a local hospital for testing and it takes 24 hours to get that result, does the student remain at the hospital? It depends. So if the student's illness is severe enough that it requires hospitalization, the student obviously would remain at the hospital. But if the student has a more mild illness and still qualifies for testing, then the student may be allowed, be discharged. And in those situations, we're involved whenever we're doing testing. We can coordinate with you at the university level to make sure that that student can be isolated in the current housing where the student is, or move to another location on your campus where they can isolate.
There's a question about what is the recovery time. I can tell you that this is an example of a place where we're learning more about this virus. It appears to be maybe a couple of weeks, but we would be working with people to come up with a plan sort of on when things are safe for somebody to move around and return to normal activity. There's a question about the amount of diagnostic kits in Iowa. We work very closely with our state hygienic laboratory to make the best use of the resources that we have. We're working very closely with our federal partners and with other states in the region to make sure that we're providing support as we need it. I think there's a question about, let's see, social distancing and graduation ceremonies. That's a great question. And again, that's exactly the kind of situation that we're asking you to take the time to start to think about what that would look like for you. And again, we're basing this situation like on social distancing would be if we start to see a lot of transmission of the virus in our communities, and we want to start to make recommendations to sort of limit person-to-person interactions. So that's when we'd want you to start thinking about those things, right? But yeah, thinking about how many people you would invite to a ceremony, where you would host a ceremony, what the alternatives would be. And again, the goal is that we never end up, needing to use these plans, whether it's for COVID-19 or for flu or for something else. But we want to make sure, we take the opportunity to think through these things, and have a plan in case it's needed.
We have a great question about whether we recommend that when staff or faculty are homesick for multiple days that they visit a doctor before they return to work. And we are really going to encourage you to not require a healthcare provider note in those types of situations, because we want to make sure that we're preserving our healthcare resources for when they're, really needed to take care of those more seriously ill patients. So if someone had a mild illness and was recovering at home, we would not recommend that you require a physician's note for them to return to work. Another question from campus public safety personnel: could they attend the law enforcement presentation on Thursday? Absolutely. We'll be happy to include that information. We'll include a link to that webinar when we send out the follow-up materials from this presentation. So look for that.
There's a question about what's the percentage of students that would be ill where we'd want to shut down campus. Again, as we would move closer to this, we'd be providing you with a little bit more concrete guidance. But again, I think this is exactly the kind of question that, we're happy for you to think through right now. So what are the essential services or essential personnel that you would need to sort of maintain activities? How flexible can you be with, 10% of your staff or with electronic learning opportunities? And start to think through, for your institution, what's achievable, what makes sense. And again, we're hoping that these are plans that we don't ever have to use, but we want to take advantage of taking the time to think through what that could look like for your institution. And we'd certainly be providing you with support along the way.
Question about childcare facilities on campus. The school guidance is really, the K-12 guidance is really relevant for the childcare facilities as well. That's posted on our website. In addition, we have a webinar this afternoon for childcare facilities. So your facilities may already be participating in that. That was sent out through our partners at Department of Human Services. That webinar is at 2:30. It is at 2 o'clock this afternoon. So if you don't have information on that, please reach out and we'll make sure that you have that registration information.
There's a question about if somebody wants some of their communication or messaging to be proofed, perhaps by our public information officer. Again, I don't want to speak for her or overcommit, but I think that's a service we're happy to help provide as we go along to help give you some assistance. And her contact information again is in those slides that we shared. There's a question about an outline or guidance of information to communicate to the campus and to dismantle misinformation. Yeah, so we have a couple, I think you've seen a couple of the infographics and fact sheets that we have on our webpage under the resource section. And I would take a look at some of those to help people understand, what is the current situation, what are the things you might want to think through. And if you find that there's a specific piece of, advice or a reference that you're looking for that you don't quite see, please do reach out to us. And if we can, we'd be happy to help you, develop something.
Anything else? We've got a lot of common themes, so we're just sifting through to see if we've touched on everything. Some questions about warmer weather, whether that could cut down on things.
Yeah, the weather itself doesn't have anything to do with it, except that when it's not winter, in winter we're in close proximity to each other, we're inside, we're closer to each other. And again, that's how these viruses move, that's how they behave from person to person, and it's easier for them to do that when we're closer to each other. Whereas in the summer, when we're outdoors and doing more activities and spread apart from each other, it's harder for a virus to do that. And so that's why, in part why we see some of the seasons of flu and other respiratory illnesses that we do. So it's possible that that could change things because we're increasing distances between people. But again, it's another example of something that remains to be seen with this virus. And we want to just keep in mind all of the other options we have available to us to help reduce the spread of a virus like this.
We had a question about whether a negative pressure room is needed for assessment. It's not a requirement. You can place the patient in, and I assume this is coming from Student Health Services. You can place the patient in a private room with the door closed as long as the healthcare provider is using proper PPE. That's appropriate. There's a question about, is it okay for coaches to travel internationally to recruit potential students for academics or athletics, assuming they're traveling more independently, so not in a group. So the recommendations from CDC wouldn't extend to individual travel. I think that's a facility decision to make, and probably based on the location of where they're traveling. So I think that we've touched on all of the themes that have kind of come forth within the Q&A. Certainly we appreciate your time today, and we appreciate all of your ongoing efforts to respond to this. We'll continue to communicate with you as things change. Like we've mentioned, please keep checking the IDPH website. We'll be posting additional guidance in the coming days. And don't hesitate to reach out to your local health departments or to our department if there's questions you have or situations that you need assistance with. Thank you so much. Have a good afternoon.